Hi, I'm Mark. I'm a 57-year-old physician, a radiologist, and in 3 days I'm going to be having hip resurfacing surgery performed by Dr. Stephen Radaman in Tampa. I'm making this video to help other people who have to make this decision and to help them better understand exactly what one goes through during the decision-making process, deciding to have the hip resurfacing, as well as to see how the recovery will go, realizing that it's different for every person. I've had arthritis that's affected my activity for the past 12 years. I've managed to stay active. I'm a very active person. I play a lot of tennis through the help of Pilates and yoga and stretching, and really working on my muscles to make sure that my muscles stayed strong and to stay active. So even though I've had severe arthritis that has been limiting my activity, and did more so 10 years ago than it had 5 years ago because of all my exercises that I had performed, I've come to the point now where I'm no longer able to exercise even on an elliptical, where 6 months ago I was able to exercise for as long as 3 to 4 hours on an elliptical at any one time, and at this point I can't even go 10 minutes without having a lot of pain, which actually causes me to stop moving. I'm walking now with a limp, which I was able to overcome with the exercises, but no longer do I walk without a limp. I need to use the handbars to walk up or downstairs because my muscles basically are giving out, and too much pain for me to carry on my daily activities. I was sleeping through the night comfortably in the past several years. 10 years ago I couldn't sleep without a pillow underneath my knees. With the help of Pilates and muscle strengthening, I did improve, but at this point I can't sleep more than 3 hours without having to wake up because I'm having pain, and it doesn't matter what position I put myself in, whether I'm using a pillow and which side I turn on. So at this point I've decided to have the hip resurfacing surgery. I've done a lot of research, obviously being a physician. I knew about this surgery many years ago. I wanted to give it time to develop and for any of the kinks of the surgery to be worked out, and I'm well aware of the complications, the potential complications with metal on metal, heterotopic bone formation that can occur, for failure and need for conversion to a total hip. But nevertheless, I feel at this point it's worth the risk. I have a physician who I feel has enough experience, and I know what needs to be done, so that's where I plan. As far as where I stand, as far as the baseline, if you stand back and you can see what my range of motion, I can tell you that 12 years ago when I wanted to bend my left hip, so 12 years ago when I tried to bend my leg, this was the best I could do. With the help of yoga and Pilates and stretching, I was able to do a lot better and get it towards the midline, but this is still the best I can do. And if someone were to pull on my leg, I couldn't get it straight. My right leg is better, but there's still arthritis in that leg also. But you can see that's a lot better compared to my left, even though obviously I do have arthritis of the right leg. As far as range of motion for abduction, I can't get onto a bicycle anymore. That's the most I can get my left leg out, and that's my right leg. So for me to get onto a bicycle now, I literally have to lay a bicycle flat on the ground. And I'm looking forward to seeing what my range of motion and activity will be in another 3 to 6 months. So as far as my advice for anyone who's going to have surgery, whether it be hip resurfacing or total hip replacement, think doing preoperative stretching and muscle strengthening is very important. I've done that, and I'm not actually nervous going into the surgery. I understand that there are risks involved, but I'm not nervous. I've done everything that I know I can do, and I think that's very important. It's also allowed me to continue on until I no longer can do the things I need to and have to have the surgery. Even though I'm having the surgery and I expect things are going to be better, I still firmly believe that your native hip is still better than anything that we can put in there man-made. And I understand that this should last me probably the rest of my life. At this point, I know the oldest Birmingham hip implant is about 15 years old. Most of the data is 10 years old. And someone in my age and with good bone structure, I'm looking at greater than 98% 10-year survival of the implant. And it's probably going to be much longer because we are at 15 years. So I think that's very important.